Greetings, everyone. This year, I need to share my staff health training via Screencastify since we won't be meeting in person. Just like in past years, we're going to cover all of the health issues plus a little bit about COVID and masks. Welcome back, everyone. After we review the new COVID-19 guidelines, I'm just going to review health emergencies. And just as a general reminder, anytime you have a staff injury at school, it must be reported to myself or Christine. Or if an injury occurs when none of us are available, perhaps after school when you're working in the classroom, then you can call QualCare at 1-800-425-3222. So perhaps just put that number in your phone right now in case you ever need it. You can always reach out to me via email as well. And just as a reminder, our AEDs are located outside of the gym and the EpiPens are in the main office. Now, something new this year, we've all been wearing face masks this summer and we're going to continue to wear them at school. Just as a reminder, wash your hands before you put on a mask and just touch the loops. Don't touch the inside. The mask should cover your nose, mouth, and chin. Make sure you can breathe and talk comfortably. And don't forget to wash your reusable masks each day and then throw away the disposable ones. I see many people out and about wearing the disposable ones a couple times. They flip them around, and that's such a bad idea. In general, we'll be assessing children for illness throughout the day. So when they're entering school or in your classroom, if you notice a child is unusually tired, kind of flushed cheeks, rapid breathing, a new or persistent cough, please let me know. It would be best if you called the health office first because I'm trying to avoid having 3, 4, 5 children there at once. Now, just for the health office guidelines in general, of course, call me anytime you have concerns about a student. And if for some reason I don't answer and you have concerns, call the main office and they'll know where I am. For minor issues like paper cuts or chapped lips, I'll give each of you the first aid bag for your classrooms. The signs and symptoms of COVID that we're most concerned about are a fever greater than 100.4, cough, shortness of breath, and the new loss of taste or smell. In addition, you might see chills, fatigue, sore throat, nasal congestion, but please remember that the symptoms of COVID are also the symptoms of other illnesses like cold, flu, and strep. In general, with the age group we are working with, the 5-year-olds to 11-year-olds, you don't see a lot of COVID. And when you do see it, it typically came from a parent. That's how they got infected. You don't see a lot of child-to-child transmission in this age group. So please don't panic. If you have a child that seems unwell, chances are it's another virus and not COVID. But of course, we have a protocol in place and we'll move forward with assessing. In general, if a child or an adult does experience COVID, some of them may have a lingering cough for more than 10 days. At that time, they are no longer contagious as long as they feel well and just have a minor cough. People are allowed to return to their activities that they normally attend. The CDC guidelines for isolate versus quarantine, these are two words that often get used incorrectly. Isolation, think of somebody with illness and you want to keep them away from others. That might be someone who's confined to their bedroom, bathroom because they actually have illness, as opposed to quarantine, where you just want to keep those away who might have been exposed. And that's pretty much staying in your home. Don't go grocery shopping, don't go to work. And COVID exposure in general is considered if there is greater than 10 minutes contact with a known case. So, for instance, if a teacher at school gets diagnosed with COVID and you passed them in the hallway yesterday or the day before, that is not considered a contact. It has to be greater than 10 minutes and within 6 feet in general. The CDC guidelines are if you are COVID positive, you do have to be 24 hours fever free and 10 days since your symptoms began. If you're COVID negative but you're symptomatic, you have to wait till at least 24 hours till your symptoms go away. If you don't have symptoms but you do test positive, you still have to quarantine for 10 days after you were tested. And if anyone in your household is positive, you need to quarantine for 14 days from the last known exposure. Now just going to our routine first aid information. In Genesis, you will find a first aid sign, and that will list any medical conditions a student has. In addition, I will reach out to you with specific emergency health plans as needed for the asthma, allergy, seizure, and so forth. Please call the emergency medical response team anytime you sense an emergency, whether that's somebody collapsed, they're unconscious, a serious injury, seizure, uncontrolled bleeding, difficulty breathing, a severe allergic reaction. Always call for the medical response team. And just reviewing asthma for this year, we know asthma is a long-term chronic lung disease. It's triggered by different irritants, and oftentimes it's triggered by upper respiratory infections. It can be controlled but not cured, and it is about 10% of the students here at ALT. And during an asthma attack, the muscles tighten around the airways become swollen, and the mucus blocks the airway. There's less movement of air in and out. The early signs of an attack are going to be coughing, wheezing, chest tightness. If that happens, please call the health office and send a student with a buddy. You will know who has medication at school as well. For an asthma emergency, a student or adult might have difficulty walking or talking, bulging neck muscles, nasal flaring, difficulty breathing. Please call me at extension 5303 or the main office and request the nurse. If you really think it's a medical emergency, then ask for the medical response team. And while you're waiting for the nurse, you can always offer reassurance and support. Don't move the student a lot, help them sit upright. Some of the 4th and 5th graders will be carrying their inhalers in their backpacks, and I will let you know if that's the case. If so, you can always assist them in getting their inhaler and taking a puff or two before I even arrive. Common triggers of asthma: strong odors, poor ventilation, mold, mildew, animals, emotions, exercise, and upper respiratory infections. So to reduce the triggers, we can reduce classroom clutter, avoid area rugs, use covered bins, use low odor supplies. And the cleaning products we use are approved by Mr. Shimko. And of course, report leaks, odors, and mold problems, again, to Mr. Shimko. We do have a couple students with diabetes here at school. And just a general review, type 1 is an autoimmune disorder where the beta cells, which produce insulin in the pancreas, are destroyed. They will need daily insulin for life. It's most common in children and adolescents. And this is about 5 to 10% of diabetes cases. Much more common is type 2, where people become insulin resistant. We most often see this in adults. We are starting to see it in some teenagers, and there are some contributing factors, not in all cases, but you do often see people that are overweight, just a genetic predisposition, different ethnic groups, and also inactivity can all contribute to type 2 diabetes. In type 1 diabetes, some of the symptoms you might see are excessive thirst, frequent urination, weight loss, fatigue, blurred vision. And we're not exactly sure of the cause of type 1 diabetes. They do think it's a combination of genetic and environmental factors. As you know, the state mandates glucagon administration delegates for any student with type 1 diabetes. And so far, I've been really lucky that the paraprofessionals that work with our diabetic students have been awesome in being delegates. And if you're interested, please let me know. Type 2 diabetes develops slowly. As I mentioned, people might feel tired, thirsty, hungry, and sometimes you don't have any symptoms. You just find out about it when you have routine lab work. And there are medications as well as diet and exercise to treat it. Now, hypoglycemia is what we most worry about with diabetics in the school setting. And for hypoglycemia, it's considered a blood sugar less than 90 if you're 5 years old, 80 if you're 5 to 11, and less than 70 for 12 and above. And this can become a diabetic emergency because someone whose blood sugar gets so low, they could faint, have a seizure, lose consciousness. And it's very easy to treat. We just need to give carbohydrates, but it's important to realize what's going on before it gets too late. And here are the general symptoms of hypoglycemia. I think we've probably all felt them at some time when we've waited too long for our next meal. And those feelings can be kind of anxious, racing heartbeat, feel dizzy, headache, irritable, shaky. And so those are the symptoms that you look for hypoglycemia. Next, we have seizures. We currently have 3 students at school who are diagnosed with epilepsy or seizure history. And it's really important to report any seizure activity to the nurse. Again, call for the medical response team or call me at 5303. If you see a seizure occurring, it's very important to stay with the person, look at the clock and see what time it is, because many students have a treatment plan where we will give medication if a seizure is longer than 3 minutes or longer than 5 minutes. And it's also very important for their physician who's treating them to know how long a seizure takes. So if you could look at the clock, see when the seizure started. Of course, we want to protect them from injury, maybe assist them to the ground, make sure there's nothing they're going to hit their head on or harm themselves. Don't ever restrain a person. We don't ever put anything in the mouth. And if possible, help the person to assist them to their side as the seizure subsides. And then we'll offer reassurance while we wait. As we move on to allergies, we have about 21 students with allergies at school, and the most common are nuts, dairy, eggs, fish, and soy. You will be made aware of the children in your classroom with allergies. And in general, we don't allow sharing of food. That's the most important. And if you could encourage your children to bring fruit, vegetables, healthy snacks, and avoid nuts at snack time, that would be great. If by chance someone does have a granola bar or something that may contain nuts, please make sure that they wash their hands and wipe their desk afterwards. For any classroom parties, I must check the food before it goes to the classroom. So make sure any food coming into your classroom has a note on it that I have initialed that it's safe for your students. We do encourage parents to provide an alternative snack for students with allergies. And you need to avoid using allergens in your lessons. If you are going to use an allergen from one of the students in your class, please make me and the parents aware ahead of time, and we'll see what alternates we can use for that specific child. And all school-sponsored functions, such as athletics, clubs, field trips, do require that we have a delegate trained to administer the EpiPen in the case of an emergency. And I know many of you have been delegates for me before, and I would be so grateful if you continue to be a delegate again this year. What we're going to do to avoid the in-person is I found this great video. It's 8 to 10 minutes. I'll have you watch the video, and then it prints out a certificate that you watched it, and then I'll just give you the general information for your student. So it's going to be much easier this year, and many of you are mini experts already. So I'll send that information out at a later time. So all staff members do need to be aware of students under their supervision who do have allergies and may need an EpiPen. So we do want to be prepared in the case of an emergency. So what causes an allergic reaction? It's basically an immune system in our body that attacks the food or substance in the food. The blood vessels swell, and the smooth muscles in our lungs contract. We also might see red, swollen, and itchy skin. The most serious signs of anaphylaxis are difficulty breathing, swelling of the tongue, a hoarse voice, wheezing, dizziness. Somebody, of course, loses consciousness. That would be so serious. Some of the more mild signs are itching of the lips or face, a few hives, tingling, a little bit of abdominal discomfort. Anytime somebody has two mild symptoms, that's also considered a very serious reaction. So, how are you going to help? First of all, just relax and breathe. If you do think someone is having an allergic reaction, don't hesitate. If it's just a couple of hives or they tell you that they have a little bit of itching, you can send them to the health office with a buddy. Just give me a call and let me know they're on their way down. If somebody is really having difficulty, then please call the medical response team and let us know what the event is occurring, and we will bring the EpiPens with us to the scene. You can call the office, you can call 911 or have the office call 911, might be easier. And just as a reminder, anytime we do administer epinephrine for an allergic reaction, we're always going to call 911. So these are the different types of epinephrine. We've got the Auvi-Q and we have the EpiPen, and the EpiPen has changed. We now remove the blue cap, blue to the sky, orange to the thigh, and we just hold for 5 seconds. You'll hear a click, hold for 5 seconds, and then massage the area. And Auvi-Q is the same. You remove the cover, press against the thigh, and that again is 5 seconds. Then you massage the area, and the student must go to the hospital. And then you can dispose of the injector either in the health office or we can give it to the EMS. And I hope that you'll become a designee and hopefully save a life. Actually, I hope we don't ever have to use it in school. Lastly, we have bloodborne pathogens. Universal precautions just mean that we treat all human blood and body fluids as if they were known to be infectious for HIV, hepatitis B, and other bloodborne pathogens. We observe universal precautions, which just means using gloves and or masks to prevent contact with blood and other infectious materials. As you know, my mantra is if it's wet and it's not yours, don't touch it. This is just a photo showing you the correct way to remove gloves that are soiled that might be contaminated. And what you're trying to avoid is getting any of that on your skin. So if you look in the first picture, they're grabbing the glove, they're holding it in their palm, and then you slip your fingers underneath to remove the second glove. For any potential contamination, if you did get some saliva or some blood or something on your skin, wash the affected area with soap and water for 20 seconds and call the custodian if you need soap in your classroom or if you have any concerns. Again, wash your hands after removing gloves. If you feel that you got something in your eye, just rinse your eye under the tap water for at least 5 minutes. And if you have a body fluid mess, your custodian knows best. So call Mr. Shimko or who's ever working that day. Please check with your physician regarding vaccines. There is a pneumonia vaccine for adults, shingles. We're supposed to get tetanus every 10 years. We do the annual flu clinic. It will likely be held at each individual school this year instead of one central location. And then hepatitis B, we should all have. You cannot get hepatitis B from the shots. It requires 3. Employers must make that available at no cost if there is a potential BBP exposure at work. We are your school nurses. Please reach out at any time. Again, this is Jan Brennan. My extension is 5303, and I'm looking forward to a great year.